Hello, everyone. Thanks for joining us today. I'm Karen Blum, and I am the Health Beat Leader for Health Information Technology for AHCJ. This webinar is one of a series of topic-specific training opportunities to brief health journalists on the latest information in a particular health area and to give them story ideas and resources that you can all use in your work. Today, we'll be covering artificial intelligence, or AI, and dentistry. A host of new AI software products have emerged that could enhance dentists' ability to detect tooth decay, cavities, or bone loss, and help propose treatments before dental health worsens. The FDA already has approved 8 of these products, with potentially more on the way. Some large corporate dental chains already have begun using these in their practices, and so we wanted to provide you with an update on what's happening in this field. And we have joining us today our 2 panelists. Roya Zandparsa is a dentist who lectures at both Tufts and Harvard universities and who has tested several of these AI products. And Casey Ross, who is a national technology correspondent for STAT, who wrote a detailed article on AI in dentistry last fall. So here is the format that we're going to do today. First, Roya has a brief slide presentation to let us know about some of these products and how they work. Then we have some questions for Casey from the journalism side on how we can best cover this field and where to find knowledgeable sources. And then we will open this up to your questions. So please put those in the Q&A box and not the chat, and we will ask them as they come up. So Roya, we will turn this over to you.
Yeah, thank you so much, Casey, and thank you so much, Karen. It's wonderful to be here. So I would keep it brief. I just wanted to just go over a few slides. Let me just share that with you now. Okay, are we good?
Yep.
Okay, perfect. So a little bit like a brief introduction, basically about a lot of advanced dental technology that have been revolutionizing dental practices. And basically, it varies from record keeping to diagnostic to treatment planning to the fabrication of the prostheses, the crown caps, and also it's been taken it to different steps of basically milling, printing, and all that. So to basically summarize some of these, maybe you're visiting your dentist, now they're using a different scanners to, instead of taking the impression with the, gluey, different, materials, now they're using, intraoral scanner to take the impression. And they basically also, there is a lot of way of fabricating those processes, and some of them basically with the 3D printing, and the 3D printing basically scans, and the smart printer now is on the market. So, some of also the area of measuring the gum disease, like the period charting, and some of you guys might remember visiting your dentist and they're basically poking your teeth around it to get some measurement to evaluate, the disease or the gum disease or not. So now that can be done with like a basically touchless period charting, so less cross-contamination. And also in an educational setting, we use the virtual reality, and dentists usually, or the student, they zoom through this 3D teeth and supporting structure to be able to see better and be able to educate our students better. Robots and artificial intelligence have been leveraging into many applications. Every corner of the healthcare and dentistry actually is not, just becoming much more newer in dentistry. The robots basically started to drilling about like a people's mouth, and they have the potential to hopefully enable more efficiency and perform faster and maybe less invasive over time. So there is a lot of automated function and AI that helps with the numerous work steps that, makes it easier for us to trace relevant anatomical like a structure, helping us to place a desirable implant in a, right location. So, and also it makes it easier to communicate between colleagues and other professionals, and be able to place the implant more precisely and more accurately. When it comes to healthcare, basically electronic health record, Also, there is many studies have been done, and that shows that, artificial intelligence can be used to sort this information, that they're helping with classifying patient, putting this into, more structures and be able to extract some insight. That insight could help us, helping us to be able to diagnose better, and hopefully we will be able to prevent diseases. Actually, 40% of the hospital, in during COVID, they basically announced and reported that the public health agency inability to effectively receive patient data was on a major barrier for the physician when they're facing with the COVID. So information data is power, and if we can use AI to basically, you have a link between the oral and overall health, that would definitely help us a lot. And another application on AI, some of you guys might know this, is a teledentistry that becomes very popular again during the COVID. That's a virtual consultation with the doctor, the dentist or the doctor being able to monitor their patient remotely. But also this is a huge thing when it comes to the underserved area, that we would be able to use this technology to be able to monitor our patients. So AI technology, there is many of them, different company here, but in Europe, you see even more and more. And the reports that comes out, it's just from diagnostic reports, from treatment planning, some of them making some suggestion, recommendation. So basically that would be in a category of the caries detections, basically identifying some landmark analysis, for basically, this is very important in orthodontics treatment, but also it also helping with the like a sleep apnea, right? If you wanted to measure the volume of the airway space, that's something again that could be very helpful. So, many AI companies, as Karen, you said, have the FDA clear platform for decay detection, for calculus detection, or calculus or build-up, for bone loss qualifications, and also some of them identify the periodontal or restorative treatment and making suggestion, making recommendation based on that. Some of them, they are into the practice, management and making a recommendation when it comes to the practice management. Here you see, I like this slide because it shows you before detection and after detection, and the color coded is after detection. And as you see, it's easier for patient to see when we're talking about the crown. You see it in blue or restorative. If it's red, it's usually is not a good sign. So like the decay shows in red, you see the root canal or some of the perio measurement or bone loss measurement. If it's green, it means that it's within the range. Usually the range is like let's say 0, there is never 0.1, let's say, to 3 millimeters normal. Beyond that, it shows in red, and it gives some measurements. So it's easier for the dentist and patient to see where are the area of the concern and where are the area that the dentist or patient has to look into, right? There are way also to detect or maybe, the third molar, the impaction or the percentage of the impaction. This is for those of you guys that have kids or yourself, if you're younger and you have wisdom teeth. So then it shows like a little bit of the percentage of the impaction. And also it shows some of them by percentage. So the caries detection, it could be based on the percentage into the enamel. So what percentage it's already been, traveled or proceeded, inside the enamel or dentine. And sometimes it comes as a percentage of the missing, the DMF. That is another, basically way of them measuring it. So in this slide, as you see, sometimes it's very difficult to, you have to have the dentist should have a precise X-ray, or, if the X-ray is not taken in a right angle, the AI would not be able to detect it precisely. But even with that, a lot of times we have seen with the different technology, different AI company, that sometimes the overlap or basically, the void or prosody or different, it could be mistaken as cavity. So that's something that the dentist really should be on top of this and make sure to separate or maybe take more X-ray, more precise X-ray in the right direction or angulation to be able to identify those. In practice management software, There is a lot of software out there that basically they identify the opportunity. It's highlighted for the dentist that how many of the basically the findings or how many crowns need to be done in that practice, how many scaling root planning, how many cleaning, how many X-ray has been done that hasn't been charged. So there is a lot of insight given to the dentist to basically look into in real time and look as an opportunity and finding and maybe make them to basically reevaluate that and schedule appointment for patient to do those certain procedures. So and that usually there is a dollar sign associated to each one of these, from fillings to preventive dentistry to X-ray to crowns, and basically this is like for the potential revenue growth for each practices that but when it comes basically to practice management, as I said, it's also the automation that it's caused from identifying which patient call, how many patient cancel. There is so many different way of AI giving insight to the dentist to use that for not only automation, but also some of the insurance company now they're using that for auditing, right? For auditing dentists, if they've been billing or been sending the claim, and which might not be the right claim, so it gives some information on that, and but also using it for auditing as well. So dentists becoming over relying sometimes on AI program, the ones that they're using it. So that's always created a little bit of the, maybe potential overlooking into the clinical judgment and human intuition in diagnostic and treatment planning. And some of the, basically advantage of the, basically AI in dentistry could be we using it as a second opinion or virtual second opinion. I like to consider it as a tool. So, and mainly because it would be a tool to use, not a second opinion. Sometimes you might need a second opinion or third opinion to make sure that's precise. So a lot of them, as I said, the new clinician or hygienist might be using it for diagnosis or treatment planning. We're going to talk about this, more. So, but also there is a lot of challenges associated with that. The challenges could be, for example, sometimes, as I said, there might be some issue like a burnout that overlap that is not, might be decay or maybe mistaking it the calculus, but is not the calculus. There is a sensitivity and accuracy with every software, and sometimes that might need improvement. The information has to be correct. There is a training, obviously, for dentists or hygienists or healthcare provider in general. They need a lot of training, and some of the company, they provide some training via the, remotely, but I think I realized that that's not really enough. There is a cost associated with every technology that you adapting. And another thing that you have to be sometimes careful is the data that often that we use for both training and testing that might lead to data snooping bias. So that's something that we have to think about. We're going to talk about all this in more details. I just wanted to just give you a little bit of the overview of the, what we're going to be discussing today. But as you know, the machine is constantly learning, and there should be more research, and should be more report, basically regarding to the AI and adoption of the AI, and ensuring that the information that we provide into the patient is accurate, it's precise and accurate. So there is much it's happening in the future, the AI and precision medicine or precision dental medicine, and then be able to analyze a lot of data. This is the picture I put here is the view. It is some of the university have this dental chair. This is the minute patient sits on this dental chair, it starts collecting data, and as I said, data is power, and hopefully we would be able to use the technology to analyze this massive amount of data, and allowing us to be able to have a more tailored approach to patient care. So I leave it to you, Karen. I just want to stop sharing, and let's just go back to the questions.
Okay, right. And I have one question for you before we go to Casey, and then we'll come back and get everyone's questions. So what is the response among your colleagues in the dental community? Is this something these technologies something they're excited about or skeptical about, or are there mixed views? I guess, what do your colleagues think about this?
Yeah, I think pretty much there's a mixed feeling. So there are many dental professionals that they are excited about the new technology, and they think that that's going to improve their work. Usually the dentists are really like a technology savvy, and they think that's going to help them with the making better diagnostic, better treatment planning, and also catching, oral disease much earlier. So there is a potential for the technology to make, even administrative tasks much easier, streamline the workflow for us and boost the patient, practice efficiency and revenue, boost the revenue for the practice. However, there are some dental professionals or some of my colleagues that are more skeptical about the relying too much on AI. And as I said, it's sometimes, might not be that reliable or accurate. So you have to pay attention to that, especially when it comes to more complex tasks like diagnosis of the conditions, or that that could basically potentially lead to an error. Sometimes AI could make mistake, so and might or they have the potential to misinterpret the data, so that could lead to maybe incorrect diagnosis or treatment recommendation. So I think we all have to become more cautious about this. And some people are skeptical because they don't want to be relying too much on technology, because sometimes, when you're relying on any technology, I would just say even phone, right? Sometimes I don't even remember my own phone number because you're so reliant on the technology. But then in dentistry, that could, they feel like they're losing some of the sight of their own clinical judgment, right? And some of their intuition, right? So, and there is all, other, basically, additionally, like there is some concern when it comes to patients' privacy, data security, obviously, and some of the, if the, for example, there is some liability if, for example, AI make a mistake and there is an error, or how would we going to be approaching that, right? And if you, it's not about, I always said, it's not just about a small mistake. If the AI recommended a filling or crown and you're doing a crown that it might not be necessary for that patient, so then you're opening up for some liability in that case. So you have to be very careful. There is obviously, as I said, there is some excitement about it, but also some people are very skeptical about that as well.
Okay, thank you. All right, so I'm dropping into the chat a link to a story that Casey did for STAT last fall that looked at this issue. So we're going to turn a few questions to him now. And Casey, maybe tell us, I think we talked a little bit about it during the planning for this program, but can you tell our listening audience what gave you the idea to write about this story?
Sure. I received an email, and in the email it was from a large chain of dental practices. And the email said that the use of an AI tool had increased treatment opportunities by 30%. So as a journalist, immediately my antenna, goes up there because I'm then immediately concerned about, well, what is this AI actually doing and who is it benefiting? Because right there we're saying that it has a financial benefit to dentists. It didn't say anything about the patients in that regard. And what is the AI, if it's increasing treatment opportunities, leading to better care of those patients? And so I started to look at it from that perspective. And I think it's really important when you're thinking about this technology to ask questions about the science behind it, who's using it, who's really benefiting from it, and whether the science that's done on the use of the technology proves that benefit or not.
Mm-hmm. And how do you balance some of the hype around these technologies with solid reporting?
Yeah, it's the hardest part of the work because you really do have to ask questions about these tools that get behind the sometimes exaggerated claims about what the technology can accomplish for a given task. So it's really important to ask questions when you're talking about AI about, okay, well, how was the AI developed? What data were used to develop the tool? What testing was done on the tool? Is the testing data different from the data on which it was trained. Because if there's any overlap between the two, then you don't really know whether the AI tool, when it's exposed to new data or different patients, whether it's going to maintain that level of accuracy. So it's just really important to ask those kinds of questions anytime any AI system in healthcare or another domain is being put forward.
Right. And where would you suggest journalists can find some unbiased sources who can comment on these technologies or provide insight?
Well, there's a lot of opportunities. I think, the one that led me to Roya, for example, was Harvard was holding a conference on the use of AI in dentistry in November. And a lot of times that's where I'll find sources, is either by attending or just scanning through the agenda and see who is talking on those kinds of subjects. That ends up being a really great way to find sources. You can also obviously use social media to do those kinds of searches and find folks who are commenting on the subject and who are knowledgeable about it. I find that a lot of higher education institutions tend to have experts who are looking carefully at these technologies and are also independent, not necessarily benefiting from their use, but doing a lot of the science to sort of sort out the level of benefit they provide.
Right. And then without scooping yourself with future stories that you might be working on, are there potential story angles that you would recommend that journalists go after who might be interested in writing about these?
Yeah, I mean, I would really begin to look at the scientific literature and the evidence that's built up behind the tools, and look at whether that science is actually being performed. Are there well-designed, well-controlled experiments being done on the use of the technology to see whether it provides a benefit, and if there is a benefit, who is actually benefiting? Are there financial outcomes for the dentists that are improving, but not necessarily seeing the commensurate benefit for patients? It's really incumbent upon the users of the technology and the folks that might regulate it to ask, those kinds of questions and to see whether the science is really being done. And it's going to take a while, I think. I think it's really unsettled science as to whether or not AI benefits in these circumstances. There's sort of an intuitive value proposition from its use because it can spot dental problems earlier in the course of disease and then allow interventions that reduce the cost for patients. But there's also the potential for abuse. And so looking at that potential and considering what's being done to examine it, I think are really where the stories lie.
Okay. And Roy, actually a similar question for you. If you look at stories that are covered in the media, is there anything about AI and dentistry that you're not seeing that you would recommend that journalists pursue?
I think I like that, journalists to, as Casey was saying, there is a lot of, we had the first conference, actually global conference on AI at Harvard Dental School. And there is, the AI company, they don't say that this is 100% precise or accurate. And a lot of time when we use them, they actually want dentists to give them feedback. So obviously there is a lot of limitation to the AI program, but something that I would love to see. Many universities, many schools have not adapted the technology within their curriculum. And I'd like to see that because I think that would be a best area for us to be able to validate some of the results, right? By cross-referencing them with the clinical examination findings and, other diagnostic tests to make sure that they are accurate. And for journalists to find this information, I think it's actually said it's a evidence-based article or, publication or anything like that, or just basically being in touch with, those top universities or people that they're basically using the technology. Some people talking about the technology, but they never ever have used it themselves in their, within their practices. So it's very difficult to basically pinpoint on the, the area that might not be, accurate. So I think being transparent, and staying informed, and using your own judgment to seek, evidence and see where you can find them, and I think, as Casey was saying, I think school, universities is still better than many other places. And as I said, have some of them, implemented some of the AI within their curriculum, but not as a whole, and I like to see that, because that's where I think the student could learn from, and then actually that would be something that we could do research on, and we could do a follow-up and then validate the result.
Okay, thank you. Okay, we have a question from the audience. The person says, I don't have dental insurance, but for people who do, is use of any of these AI enhanced technologies covered by insurance? Or would a patient have to pay out of pocket or potentially decline using them?
Yeah, no, actually, this is a tool for dentists to have. It's like basically dentists utilize a lot of tools or programs, to basically help them with diagnosing better or running their practices. So there is no insurance code for that. It's on the dentist. And, to be honest with you, if they detect diseases, right? If they detect anything, that would pay for it. So there is no charges associated with the technology, and there is no code, and there is nothing for the insurance to do. However, saying that, we're talking about caries detection. If we talk about caries detection or doing some screening tests to basically maybe running different tests using AI technology to detect some other oral diseases, right? As I mentioned to you, maybe oral cancer, maybe there would be a charge associated with that, and maybe the insurance company would have a code for that. But just for the caries detection and like maybe gum disease and all that, there is no code or charges associated with that.
Okay, so for example, like I have a screening mammogram scheduled this week, and then they sent me a note, oh, for $40 more, I could apply some AI detection to the mammogram. But you're saying this does not work like that. This is just a tool that dentists would incorporate into their practice.
Yes. Yes.
Okay. And then there's another question, says, one of your slides mentioned that AI can help lower the cost of treatments. Can you help explain how?
Sure. And actually, this is something that I get excited with AI because I think AI has many benefits. And one of them, if it's early detection, right? And let's say if you have a cavity and the cavity is only in the enamel, right? It just did not travel to the second layer of the tooth structure. We don't want to be too technical here. So that means there is a chance for you and your doctor to help you to reverse or help you to remineralize that tooth. So, and prevent that cavity to travel much faster, quicker, and get to the basically destroy your tooth. So in that sense, if AI detect the caries, early on when it's incipient or it just barely touches the enamel, the dentist could help you, or you could help yourself to remineralize that tooth. And so basically it would go away. So you're saving time and you're saving money. So that would be in every time that you do early detection. Or let's just move it to this. If you have a small cavity and the AI help you to detect that a small cavity, and you take care of it as a small cavity, before it gets to become a crown, right? I had a small cavity on one of my tooth. I procrastinated it, took too long, and by the time I got there, my fault, it turned into a crown. So one of my doctor was saying, one of the AI that we implementing, this is one of the positive side of it. It was a very pinpoint, a small cavity, but underneath it shows a bigger cavity. So she said when she opened it up, it was much larger. So she's happy she did that because it prevent her to move, like making a crown for the patient or cap versus a filling. Filling is much cheaper, less costly than a crown or cap. So if it gets detected early on, I think that's always that you can make a precise diagnostic and treatment plan, and then that would be cost effective.
Okay. Another question, are dentists promoting these new tools as either less painful or easier as an option to help patient compliance around annual checkups or cleanings?
Well, it has not. So there is so many different AI gets implemented within dentistry, but the AI, the X-ray detection. So when you get the X-ray, as I show you, it shows a different, like a color coded, so like the different fillings versus the cavity and all that. It just gives a good visual for the patient and for the dentist, especially the new graduate, to see. So that's very helpful when it comes as an educational tool, right? There is no fee, as I said, associated with that for the detection. It's just part of it, and hopefully it would help the dentist to be able to, just say, okay, take a look at this, a cavity. This might be a cavity, so the dentist could accept or reject that, and then based on what Casey was saying in the beginning, this information, actually most of this software then require the dentist to give them those feedback, because it's at the end of the day, it's machine learning. The machine learns from it, and hopefully they would, improve over time, right? So when it comes to that, basically, there are obviously there is some limitations, right, to it. And the dentist should know about the limitation, but anything regarding the AI, I would just say there is a lot of positive side to it, depending what AI we're talking about, and what are the implications of the AI. So if the person could just maybe ask the question, like, I just don't know what type of the AI would they get. Is it just for detection for the X-ray, or we're talking about other diagnostic?
Okay, yeah, unfortunately, that's not clear from the question. Yeah.
One thing I would add to that is that, what I've seen a lot of dental practices sort of advertising with the use of AI is that it increases treatment acceptance. So when the dentist looks in your mouth and says, "Hey, you've got 4 cavities," as a patient, you have a decision to make there. Okay, do I fill the cavities or do I not? The dentist is telling me I need to do this, so most of us go ahead and eventually do that. But there's still this problem that is in, I think, every patient's mind. Is the dentist just trying to make money by telling me I have more cavities and needs to do more work on me, or do I really have cavities? And what the AI helps to do is really facilitates a conversation, because the dentist can then say, look, we're looking at the screen together, and we're seeing what the AI calculated, and we can have a conversation then about what we're seeing on that image and what it means to me. So it begins to provide more information, and then you can have kind of a better conversation. So I think that's a real positive, benefit from the use of it.
Right. Absolutely. Like, it's really important to know that there've been incidents, right, that this finding might be incorrect, right, or misleading. So the dentist should approach basically using this AI program in, basically with cautious, right? As I said, it's a tool to assist in decision making rather than definitive diagnostic tool. It's great to use for patient education and showing patients like the different area, because I'm a very visual person, and I think that's helped patients to understand if they have a bone loss, if they have a cavity, or if the root canal, they have a lesion around the tooth, would be able to visualize that, right? So for that purpose, it's definitely 100%. But there are going to be incidents that might not be precisely and accurate, so that's something that, Casey, even without AI, trust me, when I had my own practice, there were patients coming to me with the list of different dentists, told them that they need to get done this like a 10 fillings or 12 fillings. And I would look at it and I would just say, there is no cavity in your mouth. These are all staining. They're not cavity. And then sometimes patient would tell me, are you sure? I'm just saying, yes, I'm sure. So I think, unfortunately, when it comes to treatment planning, even without AI, there is always a chance that, now with all respect, any healthcare provider might be wrong or might not, might over treatment, treatment, or some people even under treatment. So I think the patient gets hurt both way. If you under treatment or over treating, if patient has a small cavity that can be remineralized and can be taken care of immediately. If you let it go and it become a big cavity and filling, and then crown or maybe losing the tooth and need an implant, then so you know, under treatment in that patient. Over treatment, it would be something that you use in the AI, as I said, if there is an overlap, if it's a, you know, if it's basically a burnout under X-ray and different shades of gray, right? So you considering that, you know, it's a cavity, then you could just basically over treatment with that. So, you know, there has to be a way. I always say to the patient, take charge of your own health, right? It's nice to have technology. It's great to use that as a tool to assist the patients or even dentists and, you know, everybody in the decision-making process. But you should maybe sometime, if you're not 100% sure, get a second opinion, get a third opinion, and take control of your own health.
Good advice. And I'm curious, when you showed the slide about teledentistry, how does that work? Would that be the dentist interacting directly with a patient, or it would be like an expert like yourself directing maybe a dentist in a smaller community who had a patient with them?
Yeah, it's actually this remote monitoring or teledentistry is becoming very valuable for patients. For me, it's really have a very great place in a remote or underserved area, you know, to be able to help, you know, those that they don't have access to dental care, right, without them being really traveling or coming in person to in-person visit. Another thing that has been used a lot, teledentistry in orthodontic treatment. Some of you guys might have an ortho treatment or, you know, orthodontic treatment, or maybe in the process of getting an ortho treatment. And as of, you know, one of the things with the ortho treatment, you have to make many trips to the dental office for adjustment, for checkup, for a follow-up and all that. So I think, you know, remote monitoring help a lot with that, because it's basically, you know, patients could take a couple of pictures, send it to the dentist evaluate that and makes some report and sends back to the patient. So there is actually the whole application for that, that it takes place. But another thing, just for the simple version of it, let's say, you know, I mean, it happened and some of my patients do that. All of a sudden, you know, I just got a call a couple of days ago, my friend's going on vacation and he said, okay, I have this, my tooth, you know, it's a dark silver filling. It seems loose and I just don't want it, you know, I don't have time to come to the office. What should I do? I said, just take a picture, send it to me, let me evaluate it. So I think, you know, it's basically helping patients a lot with just minimizing the number of the visit to the dentist and helping a lot of other professionals, because specialists, to basically be able to monitor the patients better.
Okay. And is there enough you can tell just from the pictures?
Well, at least it gives them some insights, right? You know, it's and if it's needed, like let's say if the tooth is broken down or it's a big lesion, you know, then you just ask them to make a treat. But in orthodontic treatment, that monitoring follow-up, because it happens sometimes, and especially for kids, you have to see them every week, especially in the beginning. So I think that minimizes the number. For me, the most important part of the teledentistry that I hope that we adopt that technology is that there are a lot of remote and underserved area that they have no access to dental care. And hopefully using that technology, we would be able to at least just provide some care to those patients.
Right. And then I was also curious if you could pull up, you showed us the picture of the dental chair of the future, kind of. I don't know if we can put that back up on the screen, and
Absolutely.
could you walk us through where some of the features?
Absolutely.
And how soon, you know, I think you said some of the dental schools had these.
Yeah, let me see if you can. Do you see it now?
Yep.
Okay.
Yeah,
So
you just tell us what are some of these I know it was on the screen just for a minute, so.
no, so I think the whole big thing is about personalized medicine or personalized dental medicine. So the bottom line is that we really none of us, the three of us that we are here, we shouldn't have the same treatment. We shouldn't have the same medication, the dosage, everything is different, right? So think about that. You know, if these chairs, it was, actually Columbia University has this chair. I don't know if any other university has it yet. So the minute the patient sits on this dental chair, the chair starts collecting data. Everywhere you say the chair has a sensor to see what time patient is been sitting on the chair. You know, then a student that using it, logging in, that provide that information, the faculty that come to swipe. Another thing is that for us is a lot of dental instrument that we use. We got big cassette that comes with the different tools. Some of them, they never gets used. Some of them get more used than others. So give some insight about that. Some of these, instrument, they have the, radio frequency identification tag. So they've been collecting data. Another goal, basically plan is to hopefully we would be able to identify some of the diseases early on, right? Like let's say an anxiety, right? Some of the patients are, very anxious about going to the dentist, and the minute they see, if we can pick up on some of these, basically, diagnostic, diseases, so we would be able to diagnose it much better. So they're using this chairs, they collects a lot of data. So then using the AI to be able to analyze this data and basically put it in a different structure, classify them, and being able to interpret them in a advantage of the data to be able to provide much better help for that patient, care for that patient. I think that's becoming more critical.
Yeah, super interesting. Okay, and then I know we're starting to wind down a little bit, but did either of you, I guess is a question, do either of you have sort of a like a crystal ball type prediction? What is something we could see in the near future?
Well, I think for me, it's, I'm optimistic. So I think there is a lot of exciting development in advancement in AI. One of the area that I'm really excited about is oral cancer. It's basically cancer detection. So there is a lot of new technology that been developed to improve the accuracy of oral cancer detection. Using the AI technology, this is AI, if AI can assist to interpret those data accurately, in oral, in pathology, basically, they use a lot of AI to interpret the biopsy result. And I think we've started to be using that in dentistry, and hopefully that would be helping the clinician to make a much better or informed decision when it comes to the patient care, right? So, but again, it's still a lot of research, and, it needs to be done in that area. Another thing that also I think, basically AI power prediction analytic tool. So there is a lot of different, tools that the dentist could proactively look into the oral health risk, right, and complication before they happen. So I think that's when I said less expensive, because if we can predict, right, before things happen, or if early on, that would be definitely like we could, offer patient a much better or more precise treatment. Another thing that is happening, I think in AI, as an educator, I think AI has started, and some of the schools have started to implement in some of these, that helping the student and even educator with the skill development and competency assessment, and making learning more, exciting and more efficient, right? It's like we used to use like the anatomy lab, but now it's just using that like a technology AI. You could just, or virtual reality, or basically mixed reality. That becoming more and more popular. So I think AI, technology, it has an incredible opportunity for both dental professional and patient, and the potential benefit of AI, it's really promising. However, it's our job to remember that while AI can provide valuable information and insight and assist us in so many different ways, but again, they should be viewed as I always say, they should be viewed as a one component of the comprehensive approach for diagnostic and treatment plan. And we have to make sure that we are, considering them, with the cautions, and implementing them with cautions.
Okay. Casey, any thoughts from you? What from your reporting, what we might expect to see?
Well, my prediction would be that there's going to be a very dramatic scale up of the use of AI in dentistry over the next 2 to 3 years. The uptake of it is happening very rapidly. Hundreds of dental offices per week are being added by these vendors, and there are now a lot of them out there. And I think that scale up can happen faster in dentistry than perhaps in other aspects of medicine, because you have very large dental service organizations that encompass hundreds of practices at a time. So as those organizations begin to take up the technology, I think a lot of people are going to find it being used in practice. And I also think that the uptake is going to outpace the science that supports the use of the technology, which is really kind of always the case. That's always happens. You know, the evidence never catches up or never gets ahead of, obviously, the technology and the use of it. But hopefully, as we start to see more of it used, we will also start to see, you know, more rigorous studies done, more evidence of what the actual benefits are and the outcomes are for patients as well as dentists.
Right. Okay, perfect.
Karen, I wanted to add to that, because this is also important that to know that also there has been a lot of focus on establishing a guideline, ethical guideline and regulatory framework to make sure that we basically, whoever that uses AI, especially in dental practice, as Casey said, it's just, you know, dentistry is easier for most of this company to basically, dentists usually they implement technology much easier, faster than any other, healthcare provider. So, but we wanted to make sure that those guidelines, the ethical guideline and regulatory, would protect the patient's privacy and safety, and hopefully everybody would, implement them with caution.
All right, thank you. So at that point, I think unfortunately we're at time. So I'm going to thank both of you, Casey and Roya, for sharing your time and insight with us. And I want to thank everyone in the audience for tuning in. If you joined us late, you will find the recording of this webinar at healthjournalism.org in just a few hours. And AHCJ will continue to bring you webinars on a variety of health topics as a perk of your membership. Have a great rest of your day and good luck on your stories.
Thank you. Thank you for having us. Bye-bye.